Could join us, especially at this busy time of year. So, extremely happy to see so many of you making time for today's presentation. So, let's get started. Today's presentation is Building Your Skills, Developing a Support Plan, episode 15, which we will be covering monitoring the support plan. All right. So connecting to WebEx, I think all of you are connected to WebEx, but if you're having issues with audio, one of the coolest things that I've found is to connect your audio and have it actually call you on your cell phone if for some reason your Wi-Fi is being weird like mine does sometimes. So I would definitely choose your connection method, call me, and WebEx just automatically calls you. It's pretty cool. Everyone is automatically on mute today, so just FYI. All right. So to ask a question during our presentation today, please use our Q&A panel that is located at the bottom right-hand corner of your screen. If you do have a question, make sure that your Q&A ask is set to all panelists, like you see here in the screenshot. And what that will do is ensure that all of our panelists who are available to answer questions will be able to see your questions. Unfortunately, the Q&A panel just doesn't work to let everyone see all questions coming in, but all of our panelists will be able to see them if you do select panelists. Here's our agenda for today. We do have an announcement and we will talk a little bit about October's survey results, and then we'll get into the meat and potatoes of today's presentation. So quick announcement, employment training, required trainings coming, employment training and informed choice training. DHS is working with the State Employment Leadership Network, or SELN, to create a customized training on employment for Minnesota case managers. The original SELN training was tested by case managers from across the country and has received positive feedback from the Minnesota case managers who have taken it. We expect that this training will be available sometime in February 2024. All case managers will be required to complete the employment training course by August 1st of 2024. For case managers that are hired after August 1st, 2024, this training must be completed within the first 6 months of providing case management services. Our informed choice training as well, case managers are required to complete DHS's informed choice training annually. The informed choice training requirement is effective beginning in 2024 and annually thereafter. We expect both of these to be available in February 2024. We will have instructions for accessing the employment and informed choice trainings in a February e-list. So do keep an eye out for that. Also, lead agencies continue to monitor and record completion of case manager training as indicated on the waiver, AC, and ECS case management CVSM page. All right, let's talk a little bit about our surveys from October's presentation. We had 57 total responses, with 91% of those responses planning to attend this month's presentation. So I hope you're all here. Welcome back. Want to just point out the agency type and responders role of those folks who responded. The vast majority of our attendees, according to the survey, were case managers, certified assessors, and care coordinators, and with the majority of those working for lead agencies. Again, we're always looking to reach the widest variety of folks on this presentation, and we would love to be reaching a wider audience of contracted agency partners as well. So spread the word and let them know that they are welcome and encouraged to attend. One thing that I want to point out here, this is a graph of the responders' tenure. It might be a little bit difficult to read, but according to our survey, 47% of the folks who took our survey have a tenure of 5 or more years on the job. 65% of the folks who filled out the survey have 3 or more years. And so before we get into kind of some of the comments that we received over the course of this series and also in October, I want to kind of point out we've been talking about this training as foundational. that it's intended for new or newer case managers or care coordinators. And so I think some of the comments that we're receiving may be due to the fact that there's really, really experienced folks taking trainings that are intended for new folks. So just to give you kind of that insight into some of the comments that we got. Also do want to give you some of those comments. Participants that took our surveys stated they want greater detail on connecting the information to where it comes from in statute or policy. That way they can go back and look for the information in that context after the webinar. One of our recipients or one of our participants wanted more information on duplication of services. So we can definitely take that away for future topic. And then I think people would like someone to navigate the MnChoices revision and demonstrate how to do the support plan in there. Adults are visual learners, and this would be so valuable. Want to just address a couple of things in those comments. We are going to continue presentations, and we'll talk a little bit more about what those are going to look like moving forward after this month. At the end of our time today, we'll talk more about that. So we're always looking for future topics and would love to hear if you want to hear more about something or if we've completely missed something and you want to hear something about it. So please do include that in your survey results. Also, we included a link on this slide to where you can find training, including videos specific to the MnChoices revision. Since that training already exists, we want to make sure to point you directly to that training since that's kind of a separate area from this particular training. Some feedback, so some themes for improvement or future requests. So the training was basically read from the slides, so it's difficult to absorb the information. It's also odd that questions are turned off for participants so that they can't see them, and some can't be answered in the webinar. Many questions are ones that others would ask or don't think to ask in the moment. This isn't helpful. So want to just let everybody know that the Q&A panel in WebEx is responsible for basically turning off questions for other folks to see. And by selecting all panelists, you make sure that all of the questions are available to all of our presenters. It's just simply the way WebEx functions. You might have attended a training in the past where they were using the chat panel for questions, and that shows everything to everyone, but also can get really distracting with side conversations and other comments and things like that. So we've heard from people that that's too distracting to use the chat panel. So we've chosen to continue to use the Q&A panel. Also, questions have to be researched in real time, and we do only have a specific amount of time for our training. And we answer everything that we can in that period of time. But if it does require more research or additional time to come up with an answer, we do ask that that question be sent in via the DSD portal or the Aging and Adult Services email address. It simply is just a matter of time and making sure that we get you the accurate information. So thank you for that comment, but I want to make sure to address some of those things. Again, if there are questions that people are asking, please share. It seems like they're directed to the DSD portal. Everything is too basic. So again, want to just kind of point out, this is intended to be a very basic series of trainings. This is foundational training for new case managers and care coordinators or folks that are newer. So if you're finding this to be too basic, that's okay. And it's okay because we didn't intend for this training to be more in depth. And we'll talk more about kind of the direction forward that we're taking in next year's approach. So stay tuned for that at the end of our presentation. So this again is our Building Your Skills series. The reason that we put these trainings together is that we received many comments about the need for foundational learning for brand new case managers and care coordinators. So we're intending this training to be for case managers, care coordinators, and assessors who build support plans. And we are using these live opportunities to pilot topics that are related to building a support plan and to gather your questions so that we can make updates as these move forward and become online modules. We are really beginning at the basics to build this foundation. So we've heard lots of people say this is too basic. That's, again, good. That's the intention, that they are basic. But we want to make sure that we have this all laid out so that when new folks come in, they can receive training that is accessible, training that they can take as many times as they'd like, and training that really does start at the beginning. So who is present today from DHS? I'm going to ask my fellow panelists today to turn their cameras on and give a little introduction. Since I'm already on camera, I'm going to introduce myself first. I'm Lauren Harrington. I am the Case Management Training Specialist here at DSD, your presenter for this series. I am a 40-year-old white woman with blonde hair. I have my hair worn half up in some semblance of a bun, and I'm wearing a black sweater. And I will ask Sarah Beauchesne if she can turn her camera on and introduce herself.
Good morning, everyone. I had restart issues when I turned my camera on, maybe bandwidth, so I'll keep it off, but I typically love to be on camera and see all of you. My name, as Lauren said, is Sarah, forgot my name, Sarah Beauchesne, and I office out of Duluth. And I am on the Informed Choice and Support Planning team, and my focus area for work is informed choice policy. And I am, like I said, I'm off camera today. I am a white woman in my late 40s, and I will hand it over now to my colleague, Victoria.
Hi, everybody. I'm Victoria Stelfox. I'm on the Support Planning Policy Specialist Me. I'm a white female in her 40s with blonde highlights, and I'm wearing a black sweater. And welcome, everybody, today.
And Liz, if you can introduce yourself on camera as well.
Well, it looks like my camera doesn't want me to be on camera. But yes, I am Liz Sisk. Oh, there I am. I am also a 40-year-old white woman with brown hair and blonde highlights. I am the Case Management and Support Plan Policy Specialist for the Aging Division.
Welcome. And Liz is a little bit of a newer face to this presentation, so we're so glad she's here with us to represent aging from their perspective too. So welcome, everyone. Thank you for being here. These are the folks that are going to be researching behind the scenes. If you do have questions, again, they'll be looking in real time to find resources to answer the things that we are able to answer today. Our lead from the Support Planning and Informed Choice team from DSD, Andrew Johnson, is unfortunately not here today as his son is ill. So just kind of let you know, we are running a little bit on a skeleton crew to find answers to your questions. So we're going to do the best we can. Again, we're going to be taking those questions over the Q&A panel in WebEx. It's at the bottom right-hand corner of your screen if you do have a question. We do ask that you use the Q&A panel to ask questions and use the survey to give us feedback. We are only able to show the Q&A questions to all of us as panelists behind the scene, but know that if your question's not answered during the webinar, that you can always send those questions directly to us via the appropriate division contact. So the DSD contact form or email Aging and Adult Services directly. So let's get into today's presentation, Monitoring the Support Plan. Hard to believe we've had 15 episodes of Building Your Skills, but very excited. So let's talk a little bit about what we've already covered. So if you are a new case manager, care coordinator, or assessor, you can find all of these previous episodes on our training archive page, which we do have linked a little bit later in our presentation. But we've covered the basics regarding the assessment process and the assessment results, including how those results impact the planning process. We've talked about the importance of researching and gathering information about service and support options to help the person make an informed choice about available options. We've also talked about information to share with the person to prepare them for their role in building their support plan. We've talked about the concept of support types like people in community, assistive technology, and also services when building a support plan. And we did an entire presentation regarding Consumer Directed Community Supports, or CDCS, and how that works. We've also talked about own home and provider controlled options for the folks that we serve, as well as informed choice requirements and their importance to the people that we serve. And we've talked about the concept of dignity of risk and its relationship to the informed decision-making process. We've also talked about the necessity of having a backup plan in case things don't go as planned, and the process of service authorization and approving the support plan. Again, if you've missed a previous episode or all of our previous episodes and you want to find out more about the topics that we've already covered, you can find them on the training archive page. There is a link to the training archive page on our resources section a little bit later in our presentation. But if you want, you can just Google Minnesota DHS Training Archive and it's the first link that pops up. That's how I find it because it's easier. You do have to scroll down a little bit to the Building Your Skills section and select which training you'd like to review. Know that we are turning these into online modules and we will be announcing those as they are created. The hope is that you won't have to watch a recorded version of this. You'll actually be able to take an interactive online e-learning and take the content in that way. So please do keep an eye out for those. Today, our learning objectives. When this training is complete, you'll be able to define monitoring and to summarize the care coordinator and case manager's responsibilities regarding monitoring and adjusting services as needed. You'll also be able to summarize the required meetings with the person and their team to discuss the support plan and to describe a notice of action and why one may be required. Note that we're going to talk about the person, meaning the person who's receiving services. We do know that some people might make decisions with support from their families or their legal representatives, but in the case of this presentation, we're going to talk about the person and their decisions. So let's get into today's presentation. We are going to talk about monitoring the support plan. We introduced this concept of a case manager or care coordinator checklist in our last few presentations. And so these are really the tasks that a case manager or care coordinator needs to accomplish in their portion of the support planning process. So once the certified assessor completes the assessment, the case manager or care coordinator and the person need to develop a support plan that's person-centered and identifies the person's goals, needs, and preferences of how they want to receive services and supports. So again, number one, create that support plan. They also need to determine the person's annual budget. They will also review the support plan and complete referrals as needed. And then we have previously talked about the approval process where the person, their legal representative, and any designated providers and care coordinators would need to review and approve the plan and also collect signatures on the support plan. That is a next step. And then we've talked a little bit about notice of action, and we'll talk more about that today. Last presentation, we talked about service authorization and entering that information into MMIS. Also, communication with care coordinators. So communicating the assessment and support planning results with the Special Needs Basic Care, SNBC, Minnesota Senior Health Options, MSHO, or Minnesota Senior Care Plus, MSC Plus care coordinator, if that person has one. Ensure that the care coordinator is aware of any recommendations for Medicaid state plan services, so things like skilled nursing visits, home health aides, etc. And then provide ongoing case management. So performing that ongoing case management and care coordination and those tasks as necessary. So the big steps that we left off with from October is that the case manager and care coordinator need to coordinate support and monitor the quality of the person's supports. So in coordinating supports, they are updating that person's support plan throughout the year. They're providing assessment and support plan information to the provider as needed, and they're communicating information from the provider regarding the person's needs and preferences, and also to the assessor conducting that person's annual reassessment. Monitoring, we're really looking to pay attention to protect the person's privacy, their rights, and also the person's health and safety. So case managers and care coordinators, so I moved my slide back, sorry about that. Case managers and care coordinators need to do monitoring activities in meetings with the person. Meetings like the 45-day meeting, during phone calls with the person, and during other points where they've agreed with the person that they want to meet throughout that plan year. So the initial monitoring plan, we first talked about monitoring when we mentioned the initial planning meeting with the person. At that meeting, the case manager or care coordinator and the person should have developed a plan for checking in with each other and communicating. So that plan should have included decisions like who should be present, where you're going to meet, when you're going to meet, and how to structure that meeting. Of course, over the course of that service year, the initial plan might have changed. It's important to confirm these points with the person and to ensure that we're respecting their needs and preferences. Sometimes the word monitoring in disability services is called assessment with a little a. It's not a min choices assessment performed by a certified assessor, but rather it's continuing conversation to address and assess the person's needs and to identify where the needs may have changed. Monitor really means ensuring that providers deliver services as written in the person's plan, continually evaluating whether the support plan meets the person's needs, and updating the support plan as needed. Person's needs can increase or decrease, and the services and supports in their support plan should be adjusted accordingly. When is a new assessment required? Assessment with a big A, a min choices assessment? Well, we ask that you use your professional judgment. Professional judgment, that's a big word. That's why I paused. Case managers, you all have professional judgment. You are all nimble and able to respond as needed for the benefit of the folks that we work with. Emergency situations might require you to act without a full big A assessment. So think about your own experience with the timeline for getting a new assessment with an assessor versus making a simple support plan update. So things like maybe a person experiences a change in their mobility. Their needs might not be able to wait for a new min choices big assessment. And maybe a support plan update is more appropriate in that case. So throughout the initial or annual assessment support planning process, the certified assessor and case manager or care coordinator are responsible to work together to ensure the person's continuity of care, responsible to follow planning and referral responsibilities as the person needs. They are also responsible to promote informed decision-making by the person, apply person-centered practices to address what's important to and for the person, and to support the person to develop goals based on their strengths, their needs, and their preferences. All of this information can be found on the support planning page in our CBSM. Let's talk a little bit about face-to-face visits. So face-to-face visit requirements, case managers and care coordinators. As of November 1st, 2023, lead agencies must meet minimum case management and care coordinator face-to-face requirements. Face-to-face requirements may only be met with an in-person meeting. Virtual visits can no longer be documented as a face-to-face visit. If you have any questions, we sent out an e-list back on April 4th with more detailed information. So regarding face-to-face visits, for our disability waivers, BI, CAC, CADI, and DI, the waiver case manager must have a minimum of 2 face-to-face contacts with the person within a 12-month period. The person's annual reassessment may count as 1 face-to-face contact when case management activities are performed at the time of the visit. For AC, ECS, and EW, the waiver ACS and ECS case manager or care coordinator must conduct at least 1 face-to-face visit per 12-month period. That visit can be included as part of the person's annual reassessment if the assessor is also the case manager or care coordinator. Again, any other questions regarding this, you can definitely put those in the Q&A, but we did send an e-list about this out back in April, and the link is on the slide. So why face-to-face? Well, there's a lot of good reasons to meet with folks face-to-face. It really may help us to observe the needs of the people that we serve. Sometimes people aren't comfortable sharing verbally what all of their needs are. They may not be comfortable. They may not share them because they don't think that there's any help available for helping them meet those needs. And you being face-to-face with them helps you to observe a need that could be fulfilled and allow that person to make an informed choice about something that might help them. It also helps to illustrate the available options like adaptive equipment or home modifications if you meet face-to-face. Also, clear communication is huge face-to-face. It helps you establish that effective communication, observe that person, learn about their communication styles, etc. Also, face-to-face, we provide accurate, complete, and timely information about all available services and supports. And it's a little less, you're a little less likely to provide inaccurate information or to misspeak, or at least you'll have a chance to correct yourself more easily in face-to-face meetings. Also, it allows you as a case manager or care coordinator to demonstrate effectively where to find resources and information about available services. So you can show them where online they may be able to find these things, or you have paper copies, etc. We must honor a person's choice and meet them where they are at. So as you know, the HCBS waiver programs are voluntary. Determining the best course of action when a person will not meet face-to-face with their case manager also requires professional judgment. Each situation that you encounter might have really unique considerations. So when coordinating a face-to-face case management meeting, take a person-centered approach. Prioritize that person's choice, control, health, and safety. Closing a person's waiver or leveraging people to meet on the basis of meeting requirements should not be our first course of action. In fact, doing so could cause significant harm to the person and your working relationship with them. Face-to-face case management meetings are a key part of planning and monitoring. An individual's plan for monitoring must be documented in each person's support plan. When a person doesn't agree to meet face-to-face, document that discussion and choice in their plan. Note that while we tell you to document it, documenting a person's decision to not meet face-to-face doesn't meet the face-to-face meeting requirement. So as a reminder, all actions to exit a person from the waiver must be consistent with continuous coverage requirements in the unwind period, which is through June 30th of 2024. We did also send an e-list announcement back in April for more information regarding that unwind period. But these can be really challenging decisions to navigate. If you're exiting a person from the waiver for not meeting the face-to-face requirement, you need to really carefully consider that decision. Talk to your supervisor and follow any of your applicable lead agency practices. We do have more information on the recording of our DSD quarterly regional updates from November of 2023. Again, this can also be found in the DSD training archive. So if you want more information about waiver termination for not meeting those face-to-face requirements, definitely check that out. So if a person doesn't want to meet face-to-face, it's critical that a case manager or care coordinator discuss the impacts of not meeting with them in person. So for example, not meeting with a person in their home might limit the case manager's ability to identify and address the person's service needs in their own environment. To support the person and their family in feeling comfortable to meet in person, have them think about what they want to discuss, who should be present, maybe where to meet, how to structure the meeting, and any safety and environmental considerations. So wearing masks, maybe socially distancing, or meeting outside, weather permitting. As someone whose family all just got COVID, I can tell you that this is still a topic because we all have COVID. So happy to not be spreading that to you guys face to face. But really, it's about creating a meeting environment that encourages the person to feel comfortable voicing their opinions and advocating for their goals. We really want the person to engage in the process of building their support plan. So all communication with the person should be based on the person's preferences. Talking to that person about the method of communication that's best for them is really important. Meetings should also be coordinated with the person and based on their preferences and needs. They also should be scheduled in a way that supports the person's choice and the person's control. So those decisions about frequency, location, participants, time, scope, and a lot of other factors, but they should be person-centered. So it's important that the case manager helps the person to schedule the meeting based on their preferences. It's also important that they advocate for the person during the meeting to fulfill the role that they desire. So if the person wants to be more involved in creating their support plan, it's important that you advocate for them. It's also important that you create a meeting environment that encourages the person to feel comfortable voicing their opinions, advocating for their goals, and engaging in the process of building their support plan. Having an initial meeting with the person outside of their home might help them feel comfortable with inviting the case manager or care coordinator into their home. When you have concerns, again, about not meeting in person, share those with the person and their legal representative if they have one, and ask them about their concerns and maybe offer suggestions on how to address those. Ultimately, it is a decision made by the person and their legal representative. A person who's accessing long-term services and support has a right to informed choice in other areas that include but aren't limited to required assessment and support planning meetings, anytime a person's making a decision and asking for support, and during transitions in life. Essentially, informed choice is how people define their relationships to their services and supports. When a person expresses any desire for different waiver services, housing, employment, or community activities, we must make active efforts to accommodate the person's wishes. Conversations about informed choice should happen regularly and should always be at the forefront of service planning. Informed decision-making and informed choice happens through engaging person-centered conversations and activities. It's a cyclical process. It doesn't just occur one time. It's ongoing. And those informed decision-making processes and conversations are a key part of building a support plan. So meeting preparation, we want you to take your time. We want you to prepare for those meetings with the person. Check in on their service utilization. Is the person using what they were allotted on their support plan? Should the service hours be increased? Should they be decreased? Check in with that person. How do they feel that their services are serving them? Do they feel they need more of a specific service, maybe less of a specific service, a completely different service? It's all part of that meeting preparation. So let's talk a little bit about those required meetings. A meeting is required for people receiving intensive support services before the provider has provided 45 days of service to the person. This is commonly referred to as the 45-day meeting. The provider will be the one responsible to schedule this meeting, and they would invite the person, their legal representative, if they have one, and anyone else the person wants present. They also would invite the case manager or care coordinator. The purpose of this meeting is to check in regarding the services being provided. Are they meeting the person's needs? At the 45-day meeting, the case manager and care coordinator and service provider need to work together to ensure the person has the support needed to accomplish their goals. So during this meeting, consider if the level of service being provided supports the person's daily needs and activities. There are some questions that are in our CBSM that we are required to cover. So things like, how will the provider ensure that the person has control of their own schedule? How will the provider ensure the person's preferences are provided? Is the current service setting the most appropriate integrated setting available for the person? How will the provider assist the person in maintaining essential and life-enriching skills, abilities, strengths, and interests? How will the provider assist the person in community access, participation, and inclusion in preferred community activities? How will providers help strengthen personal relationships with other people of the person's choice in the community? How will the provider assist in opportunities for the person to seek and work in the community? And how will the provider assist in coordinating with other service providers the person that might be working with? If you have any questions, this information is directly from statute section 245D.071. There's a link to that in our resources page at the end of these slides as well. Remember, for our BI, CAC, CADI, and DD waivers, 2 face-to-face meetings are required as the minimum necessary. The first is your planning meeting, and the second is a meeting that is commonly referred to as a semi-annual or the mid-year meeting. I put quotes around that because It's not necessarily at mid-year. It's not necessarily at a 6-month interval. But as long as it's happening twice during the plan year, that does meet minimum necessary. This semi-annual or mid-year meeting is coordinated by the case manager or care coordinator. They need to invite the person, their guardian or legal representative if applicable, and anyone else the person wants present. This meeting is really an opportunity to get to know the person on a deeper level, and ideally should be driven by the person. Ideally, the case manager or care coordinator shouldn't come in with a set agenda. It's really a time to review that person's support plan and make sure that it is still accurate and still effective for the person. It's also a time to discuss information shared in provider reports. So how are those services functioning according to the service provider? What's working? What's not working with the person's services? What needs to change? What might need to be explored further? Again, all meetings must be coordinated with the person and based on their preferences and needs. So meetings should be scheduled in a way that supports the person's choice and control. Again, the annual face-to-face monitoring meeting requirement is the minimum service requirement. Now, people are not only entitled to receive just 1 or 2 meetings a year, depending on their waiver. Meeting frequency needs to be responsive to the person and their needs and their specific situations. You might plan to meet every 6 months as a part of that initial meeting with the person, but meeting frequency needs to be responsive to their needs. So you could be meeting 4 times, you could be meeting 6 times, you could be meeting twice in person and talking on the phone every month. You could really be doing the minimum service requirement of 2 meetings in face-to-face each year. And that's okay. But again, it's about the person and what they need. The planning meeting or the annual meeting, again, might not happen exactly at 1 year, but it's a meeting with the care coordinator or case manager and the person, along with their guardian or legal representative if applicable, and anyone else that person wants present. The purpose of this meeting is to review the following with the person. So things like provider documentation, information from the person's legal representative, if they have one, or other supports as desired by the person, any other information gathered during the past year, and assessment information. This meeting is really intended to help the case manager or care coordinator to develop a support plan for the next year. We have more information about this annual meeting in episodes 2 and 3 of Building Your Skills. Again, those can be found on the DSD Training Archive, and you can take a look at episodes 2 and 3. So this is not an exhaustive list of all meetings that might happen during the plan year. Again, meetings should be scheduled as needed or as requested by the person to meet their needs. Remember, needs may change, and it's the responsibility of a case manager or care coordinator to be nimble and to be responsive to those needs and to update the person's support plan when necessary. So we're going to take a little break and see if any questions have come in. If you do have questions about the material we've covered so far, remember that we are taking those via the Q&A panel, and the Q&A panel is in WebEx on the bottom right-hand corner of your screen. So please do take a moment to enter your questions. I am going to ask my fellow panelists if any questions have come in.
Lauren, we have received a few questions. We are working on the answers and would like to ask you to continue and take the next opportunity where you break for us to reply verbally to those questions.
No problem. So again, we are always working in real time in these presentations. So they are researching busily behind the scenes. I can picture them typing away. So while they are researching the answers to all of your questions, we'll continue with our presentation. I'm going to actually just take a quick moment to drink some water. All right. Pardon me. Again, I apologize. We all got COVID, so we're all a little froggy at my house. Okay. So let's talk a little bit about the notice of action. When monitoring, whether you're monitoring by phone, in-person meeting, or otherwise, there are times where a person's services might change. When there is a denial, termination, or reduction in services, a notice of action needs to be sent. A case manager or care coordinator must provide advanced notice if there's a denial, termination, or reduction of services. They also must complete a notice of action or MCO denial, termination, or reduction form. We do have a link on the screen to these requirements, as well as to the DHS notice of action form 2828B, so that you can pull that up later. If the person receives a denial, termination, or reduction of services, the case manager or care coordinator still does have a responsibility to look for alternatives with the person. So just because something was denied doesn't mean there's no other options for that person. The case manager or care coordinator needs to continue to support them and to make a plan with them for when that termination or that denial is completed. Terminations, reductions, and denials are made based on requirements, so based on eligibility. They're not based on anyone's personal judgment or belief regarding a person's needs. If you need more information, there is a great CDSM page regarding notice of action, and we do have a link to that on this screen, as well as in our resources slides at the end of our presentation. So timelines for sending out notice of action are different based on their purpose. So if the person no longer meets nursing facility or NF level of care criteria, the county or tribal nation must send the notice of action to him or her at least 30 days, but no more than 60 days before the nursing facility level of care change is to take effect. For all other changes, lead agencies must send the notice of action to the person at least 10 days before the change takes effect. Best practice, send a notice of action as soon as you know a person's services or supports are going to change, and discuss that change with the person. Again, great information about all of this on our CDSM pages. So notice of action, they need to include things like the effective date, which is the date that the change is specified in the notice of action will change. We also need a reason, the reason for each denial, termination, or reduction. We also need the legal citation. So the legal authorities relevant to each let's start over with that one. The legal authority relevant to each action, and there might be more than one legal authority. And probably the biggest portion of this, we need an explanation. Each denial, termination, and reduction requires an explanation. The county or tribal nation must write each explanation in plain language using clear details, meaning the person should be able to understand the explanation that you wrote. It has to include why the lead agency took that action and what the person should expect because of that action. So this also includes budgetary implications. It also must include appeal rights. So the notice of action must inform the person of his or her right to appeal and how to request one if he or she disagrees with the county or tribal nation's actions. Oftentimes, people don't read their mail. I mean, have you ever thrown out a piece of mail incidentally? I know I have. Everybody makes that mistake. So don't forget to call that person, meet with that person, discuss the change with them, and really be transparent about the information given to them. We really want you to call and explain what the notice of action means, not just in general, specifically to that person and specifically to that person's situation before you mail the letter. While we're also required to send a notice of action, we are also required to plan, coordinate, and ensure that the person may make an informed choice. So if you're sending a denial notification regarding a service, what are the other available options that the person might consider? It's a great time to discuss those options. So I know we came to the end of this very quickly, but I am going to turn the microphone over to my colleagues behind the scenes who are researching answers to your questions. Again, if you have questions, use that Q&A panel, bottom right-hand corner of your screen, to type in your questions. Make sure you do select all panelists, and we will be able to look at those questions. I'll turn the microphone over to my other panelists now.
Yes, hi, this is Liz Sisk talking. There was a question about what you were referring to when you said unwind period, Lauren. And what Lauren was referring to is the ending of the federal public health emergency for COVID-19. During the pandemic and during the public health emergency, there were certain waivers put in place that we could do things a little bit differently, such as having remote visits instead of face-to-face. So when Lauren said unwind period, she was referring to those waivers being taken away and now having the same requirements that we did before the public health emergency. She did also put an e-list link to some of those unwinding.
And this is Victoria, and I can speak to the latest question that's in here. It has to do with if someone has COVID and the meeting needs to be virtual or by phone, how does DHS want you to document that? So again, we just want to reiterate that there are still visits that do require a face-to-face, but we also know that people can request to see their case manager more than the bare minimum. And if that, it just depends on the type of visit that you need to conduct with the person. So if it's not considered their annual or their semi-annual, then you can do that visit virtually or over the phone, but there still is the requirement of getting your minimum face-to-faces in. Hope that answers the last two. I think we're caught up now, Lauren.
Excellent. I was about to start talking and I realized I was still on mute. All right. Again, if you do have questions, please don't hesitate to put those in the Q&A panel. We'll make sure to have our experts take a look at those. We are near the end of our presentation today. So any last questions that you have, throw those into the Q&A panel. Where I really want to chat about this is we've gone on a journey with these building your skills sessions. We have been talking about kind of the roadmap of our learning from episode 1 to now episode 15. And today we really talked about training on monitoring and case management and care coordination. This involves regularly checking in with individuals to ensure the implementation of their support plan. We're verifying that service providers are adhering to the plan. We're evaluating the plan's effectiveness in meeting the person's needs on an ongoing basis. And we're making those necessary updates as people's needs change. So recognizing the dynamic nature of individuals and their evolving needs, when we're talking about that, monitoring really is crucial in ensuring that their ongoing supports align with their growth and changing requirements. So basically, what I'm saying is we've reached the end of our building your skills journey. We started with assessment and now we're here. So what's next? Well, coming up next, we are asking you to mark your calendars. We will be changing kind of our tactics in training from that really foundational building your skills level and introducing a new session of training called Advancing Your Skills. And this really should represent a progression beyond that foundational training. So if you consider building your skills to be that kind of level 1 training designed for beginning case managers or care coordinators, advancing your skills should be level 2. So this will build upon the fundamentals that we introduced in building your skills and delve deeper into some of those topics. We really want to address more intricate, challenging subjects that are encountered by seasoned case managers. And we're really excited about the progression of our training to this kind of level 2 area. More details about topics are going to be sent out in e-list announcements as we get closer to those dates. But we do want you to mark your calendars. So, Advancing Your Skills, episode 1 will take place on March 27th. And not in 2023, it's actually 2024. Sorry about the typo there. And you can already register for those Advancing Your Skills presentations on TrainLink. Pre-registering for all 4 of those dates will make sure that you receive the PowerPoint prior to our presentation. It will also make sure that any changes or updates that need to happen, you're already on the list of those notifications that need to go out. So take a look. You'll notice that we're also moving from monthly, bi-monthly to quarterly presentations. We'll be presenting in March, June, September, and December of next year. That was done purposefully We don't want to lose you all as audience members because you are very valuable, and we want to make sure that things get to you. But as we're moving into more complex topics, we want to make sure that we have more time to prepare effective training and to get it right. So while we will be continuing, we'll be meeting a little less frequently. But I highly recommend registering in advance for all 4 dates in 2024. We will be progressing with advancing your skills for the foreseeable future, 2025 and beyond. And likely, we will be reevaluating if this is the appropriate timing for how often we're having these, if we need to increase the time of this time period, things like that. We'll be evaluating throughout next year. So keep an eye out. And again, we will send out the topics in advance. Currently, we are meeting and evaluating and working on those. So we hope to see all of you and all of your colleagues on our WebEx meetings that will take place next year. Again, March 27th, 2024 will be our first session of the new year. And we'll be very excited to be back in your face live and giving training on more advanced topics for folks who've been doing the job a little bit longer. So I just want to pause and say thank you to all of you. Your role as case managers, care coordinators, assessors is absolutely indispensable. You all are so important as you help the people that you support make informed decisions, as you help them construct their support plan. Really, your unwavering commitment to this job ensures that people have the opportunity to live the life that they envision. We genuinely appreciate your dedication and the meaningful impact that you make on a daily basis. So thank you. Thank you for the work that you do. I'm going to pause there and see if we have any additional questions that have come in since I've been talking. My fellow panelists. I can see the questions. One I want to answer. When do you expect the December webinar to be on TrainLink? I thought it was, but maybe we are waiting on that December date. I will check in with our training and communications partners to try and get that December webinar on TrainLink. I thought all 4 of them were on there before today. So thank you for letting me know. Will they include MnChoice's revision? If you are looking for MnChoice's revision training in and of itself, they will not include that. That's not what they're intended for. This is training regarding practice and policy rather than programming. If there is something very important, we are not opposed to showing the MnChoice's revision system and showing and demonstrating within that system, but that is not kind of our first priority in these training sessions. All right, so some folks not able to see the upcoming trainings on TrainLink. I will double check after this meeting to make sure that they're all on there. If you are searching, advancing your skills, hopefully they do show up. If they are not on there, check back after I, rustle some feathers after this meeting. Any other questions that have come in for policy?
Lauren, there's one more question that came in about registering for the trainings. Could you take that one? And then we may have Liz or Victoria pop on to answer one last question that came in right at the end here.
Absolutely. So if you did receive a copy of the presentation in advance, if you take a look at this particular slide, number 55, there's a link here that says register. That should take you into TrainLink. If you don't have that presentation or you just want to quick Google Minnesota DHS TrainLink, that will take you into the TrainLink system. You should have a special unique key to sign into TrainLink. And you will be registering as you do for all other trainings. So search for Advancing Your Skills, should pull up the dates, although maybe only 3 of them. And you should be able to pre-register for each one of those. If you have questions, need to be walked through it, if something's, wonky with your train link, as sometimes happens, send a message to us through the DSD contact form and we will be happy to help. I do notice that there was one more question. Are these trainings not done virtually anymore? They will also be via WebEx. They will be in this same format, in a WebEx format, with the intention of taking the content and turning it into an online module after we've presented it live. So these are virtual trainings. These are not going to be in-person trainings, just to make sure that everybody can access them and everyone has an opportunity to attend.
So we had a question. It said you referenced being able to update the support plan versus waiting for a new assessment to increase support for mobility, for example. Does this mean we can adjust plans for a change of condition before an assessment occurs? If so, should we also be pursuing a new assessment while also having the ability to change the support plan? So that's a kind of complicated question. You can always submit a ticket and ask for a specific case consult. But in general, if somebody has a need and you can meet the need by adding it to the support plan, particularly if a new assessment isn't going to change their case mix, or if they're on CDCS, a budget, or their PCA hours, then you should absolutely be adding those services or supports. Some of those other specific areas like case mix, CDCS, or PCA, you might want to talk to your supervisor about what your lead agency wants to do in some of those more specific scenarios, or write us.
I just noticed another question come in that the survey link on the PowerPoint does not include an option to choose December 2023. Ugh, we are having issues today, my friends. Thank you for bearing with us. I will get that added to the survey and I will send that out to all participants in an email after we are finished. I will be ruffling some feathers shortly. Thank you for your patience. All right, any last minute questions, please don't hesitate to put those in the Q&A. Again, we do have resource slides at the end of our presentation and in the electronic PDF version that you received prior to today's presentation. You can click on all of these links and they will take you directly there. So we have a few pages with links that we discussed within our presentation, including those e-lists. This is where I would plug the survey. However, it looks like it doesn't include our December date. So please do keep an eye out for a separate email coming from DHS training with the link to our survey when that December date is added. My apologies, but we really do read every single one of these surveys. We take your feedback into consideration every single time you take the time to fill something out and send us your thoughts. So thank you. And thank you in advance for bearing with the fact that I'm going to have to send this to you separately. Those of you that did not receive the slides that pre-registered, definitely check your junk email. It would come from DHS training. If it wasn't sent to you, if we missed you, I apologize. The DHS training archive has this presentation posted currently. So again, the easiest way I've found to get the training archive stuff up is to just Google DHS training archive. You'll page down to building your skills, find the episode 15 and a link to this presentation. The slides are there. The recorded version of this presentation will also be there within the next few days. So if someone you know didn't have a chance to join us today and wants to listen to the recording, it will be available as well. So if your question was not answered, or if you think of a question regarding this topic and we have already concluded our meeting, do not hesitate. Please send those in to us directly using the DSD contact form or the Aging and Adult Services email address. With any questions that you might have, we are constantly monitoring this inbox, these forms, to make sure that we're getting to your questions within a few days. So if you've got something specific, a case consultation that you want some help with, let us know. That's what we're here for. Again, training archive page linked here. Not helpful if you don't have the presentation, but again, Google training archive page, Minnesota DHS. Everything will be there. All right, I'm looking to see if any additional questions came in. And as of right now, I don't see any additional questions. So again, we just really like to thank you for joining us on this busy December day. Keep an eye out for more information regarding our next presentation, Advancing Your Skills, in March of next year. I will be contacting our technical communications team and get those dates on TrainLink, and we'll be getting that survey link to all of you that have registered as participants. So please do fill that out when you have it. Thanks again. Enjoy the holiday season. Personally, I'm enjoying that there's no snow. There's enough to deal with right now. So hope that you all enjoy your Wednesday. Have a great rest of it, and we will see you in March.